So the current problem, the state of the problem and those variables that are contributing to this are the release. We'll start with the release to community timeline as it changes often after patients visit their court, the judge, lawyers, and present milestone credits that they've earned for good behavior, for attending programs, for furthering their education, and so on. So they come back with parole date changes. So they may have started a timeline of, I would say, 6 months, and after their court date, they may come back with just 20 days of parole, and that can happen. So that does occur, and it occurs frequently. So it doesn't establish a structured and consistent timeline for the discharge planning. Chart reviews for discharge planning are not done early enough. They're not being done at 45 days from parole. Nurse and parole agent demographics are not confirmed at 30 days from parole. What that means is that the parole agents who are working on placing these patients into transitional housing as they work towards life skills, education, jobs, and so on, they're not normally entering that information at 30 days consistently. Uh, the other factor is that when they do leave to the outside community, those the outside community resources are delayed in terms of making sure that we have an established contact. So what I mean by that is, as we're trying to get appointments confirmed for MAT, for chronic care, and so on, we're not getting an efficient response within a few days. It can take about 5 days, 7 days, sometimes even 2 weeks. So there's a lot of manual follow up with that. And even then, if we're dealing with a large population, that can take several hours and days as well. Um, the last factor is patients releasing without appointments, which is a main and major problem with this. Uh, for SUD, MAT, and chronic care services is only successful about 50% of the time. So that's a big gap. We want to make sure that at least 90% of our patients are releasing uh, with an established MAT for SUD, psychosocial cognitive CBI type appointments, and chronic care appointments.